This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, this time next week, Breast Cancer Awareness Month will just be getting underway, and you can expect to see just about everything turn pink. But the disease itself is so much more than just a color that represents awareness. It's a disease that 1 in 8 women will develop. Today, we want to focus on those women who are or will be diagnosed. Dr. David Seckler is the co-director of the Peninsula Breast Center. Thank you for joining us this afternoon.
Thank you for having me.
You know, I think we all know somebody who has been affected by breast cancer. Let's talk about where we are today. Are the numbers of cases dwindling?
So the data actually suggests there may be a slight slow rise in diagnosis of breast cancer. The latest data suggests about almost 250,000 women will be diagnosed with breast cancer this year in America, which is a big number. But the encouraging part of it is we're doing better with our treatment. So between finding cases at an earlier stage and new treatment options that target the therapy at the specific type of cancer a patient may have, we're getting improvement in survival. So although there may be a slight increase in the number, it's been fairly stable recently, but where we're getting some gains is in the improvement in the survival.
Right.
So women are living beyond their diagnosis, well beyond, and so that's encouraging.
That is encouraging. Okay, so you know, many women fear getting the mammogram. You know, you get that order to get the mammogram, and I think the reason is a lot of women fear of the results or what might be found. What do you say to those women?
Yes, so you had mentioned earlier we all kind of know someone with breast. My mom is a survivor. She's been over 40-year survivor. She was diagnosed many years ago, and I still hear every year she's due for her mammogram, I get a phone call. She's concerned and nervous. So I understand that concern, that fear. It certainly is an anxiety-provoking to wonder what it's going to show and the results. So to what I encourage women is that, you know, look beyond that. It's important to get the mammogram. As I said earlier, we're finding cancers at an earlier stage, and how we do that largely is through mammogram screening. And so it can be a very anxious moment or a day or two till you hear anything, but it's so important not to use that as an excuse not to get the mammogram.
Right.
So yeah, just encourage women in general as they reach the age that they should be getting screenings every year to go every year and get that mammogram.
Sure, sure. Okay, let's talk a little bit about the women who do get the abnormal results from the mammogram. What's next?
Yeah, absolutely. I'm a general surgeon. I deal with breast cancer as a big part of my practice. And so we get the referrals after someone's been diagnosed with the abnormal mammogram. There may be a concern that shows up on the imaging. And it would then, next step usually is going to be recommending a biopsy. And so we would meet with the patient, consult with them about, you know, what treatment or what diagnostic options there may be. Most biopsies now require just a small numbing medicine and a small needle to make our diagnosis if there were a suspicious area. And I tell patients too, a lot of the findings that we see on mammogram turn out to be benign, not cancerous diagnoses, which is encouraging. But also the ones that end up having cancer, again, it often is done through simple means of just a very small needle prick, basically, to do a biopsy and to get a diagnosis. So, but that's what we would talk about patients.
Sure. Okay. And then treatment. There's treatment options.
Absolutely. And again, it all depends on, you know, what stage the patient presents. Earlier stage diagnoses we can treat with what's called breast conserving surgery. Lumpectomy, as opposed to in the old days we had to recommend mastectomy. That's much less common now. And so again, the importance is finding early detection, mammograms early, finding it at an earlier stage where we could offer less invasive treatment options.
Right.
So surgery plays a big part in the treatment of patients with breast cancer. And then again, it all depends on the type and the stage of the cancer, but other treatment options may include things like radiation treatment, some forms of chemotherapy, if it's a more advanced or aggressive cancer.
Now, with just about every disease we talk about on this show, we talk about prevention. Let's talk about prevention for breast cancer.
So we've harped on it enough today. Mammograms are a huge part in the preventative part of this. So being aware, get the mammogram early. at the time you're supposed to every year. Other preventative things, healthy lifestyle. There's a lot of studies that support eating healthy, not being overweight, exercise like it does for all health measures. It plays a role in preventative things for breast cancer as well. Restricting alcohol intake, other factors that play into this. I think a big trend was in the late 1990s. There was an understanding that too much use of hormone therapy for estrogen replacement made a big difference in potentially preventing or promoting some breast cancer. So there was a decline in the use of that, and we also saw a decline in the diagnosis of breast cancer. So that, you know, talk with your gynecologist, but there may be some indications there to do lower doses if that's another thing.
But the bottom line is to do the screenings, talk to your doctor, and try to stay healthy as you can. Dr. Sackler, thank you so much for coming in.
Appreciate it.